Andy Swachode is among the more than 7.7 million South Africans living with HIV. The 30-year-old has been living with HIV for the past 15 years. Access to daily medication is a struggle. She has now opted to share the little that she has left with those who don't have medication.
We don't even have a chance to see the sister or the doctors. We only speak to the securities or the volunteers. So we don't get treatment. We feel like outsiders, like foreigners in our country, because we voted. We're supposed to get the treatment, but we struggle to get the treatment. In order for you to get the treatment, you need to know someone or you need to have connections. So if you don't have connections, that means you won't get the treatment. You see, so we feel like our government is killing us in a way that we're using treatment, we're using drug. So if we're defaulting, that means our immune system will be weak. That means we'll be the victim of COVID-19, you see. So we are told that they are prioritizing, so they are focusing on COVID-19. So they forgot about us.
Various civil organizations have called for the removal of senior health officials. The Treatment Action Campaign also took to the Nelson Mandela Bay Health District Office. They are demanding that health must strengthen its internal responses to the pandemic.
Our people are not taking the antiretroviral therapy because of the situation. And secondly, our people are busy trying their level best to get the medication. I'm staying in Utnik, but I'm receiving all the calls across that I didn't get the medication, and I made the provision to talk to the superiors at the district level. Please, guys, can you assist me with the information that is needed for these people to be assisted?
Meanwhile, at the Osmond TB Hospital in Utnik, unions say COVID-19 infections among patients have spiraled out of control. They say there's no dedicated COVID-19 ward for infected patients at the facility.
Some patients have died here. So it is really sad what is happening here, to think that there is supposed to be management that is supposed to make sure that everything runs smooth. And what we've observed is that even the commitment from the government or from the department, where they committed that there will be renovations here in preparation for, in the event that there are patients who test positive, then there will be a ward that will be identified. But our understanding was that if that facility that needed to be renovated is not complete, those patients must be transferred to the hospitals that have been identified as COVID hospital up until they are ready. We've taken a walkabout, they are not ready.
The health department says the matter is being addressed. The health minister also urged people living with other chronic illnesses to utilize health facilities.
But we do want to encourage people to come back to hospitals for normal ailments, chronic diseases, heart diseases, immunization, family planning, and all of those. We want people to continue to get that normal treatment now so that they don't start having the problem from what was already controlled before, HIV, TB, and so on. We want to try and balance all of this up. So the easing of numbers are saying we have actually got time for people to come in. Don't fear coming to the hospitals. We are now trying everyone to make sure that we try and separate the entry points so that those who've got symptoms need to be dealt with. We've also reduced the backlogs.
According to the Center for Strategic and International Studies, South Africa has the highest number of people living with HIV-Aids. The study says 20% of all people living with HIV are in South Africa. Lwando Nomoyi, SABC News, Eastern Cape.